The World Health Organization Global Air Quality Guidelines has provided clear evidence of the damage air pollution inflicts on human health at even lower concentrations than previously understood. The guidelines recommend new air quality levels to protect the health of populations by reducing levels of key air pollutants, some of which also contribute to climate change. We have details in this report.
Since WHO's last 2005 global update, there has been a marked increase of evidence that shows how air pollution affects different aspects of health. For that reason, and after a systemic review of the accumulated evidence, the WHO has adjusted almost all the AQG's levels downwards, warning that exceeding the new air quality guideline levels is associated with significant risks to health. According to the report, air pollution is one of the biggest environmental threats to human health alongside climate change. Whilst not legally binding like all WHO guidelines, AQGs are an evidence-informed tool for policymakers to guide legislation and policies in order to reduce levels of air pollutant and decrease the burden of disease.
Because of air pollution, the simple act of breathing contributes to 7 million deaths a year. Almost everyone around the world is exposed to unhealthy levels of air pollution. Inhaling dirty air increases the risk of respiratory diseases like pneumonia, asthma, and chronic obstructive pulmonary disease, and increases the risk of severe COVID-19. It's also a major cause of other non-communicable diseases like ischemic heart disease, stroke, and cancers.
According to the World Health Body, these guidelines provide interim targets to support a stepwise progress towards developing informed policies to decrease the unacceptable health burden that results from air pollution exposure.
The last time WHO published air quality guidelines was in 2006. In the 15 years since, there has been a substantial increase in evidence of how and to what degree air pollution affects different aspects of human health.
The WHO says it is preparing a report to be presented at the UN Climate Change Conference on a bid to strengthen the importance of having more action on mitigating the causes of climate change.
WHO is preparing a very big report to be presented at the COP26 to strengthen the importance of having more action on mitigating the causes of climate change, because those mitigation of the, interventions will have enormous health benefits. And most of the health benefits of mitigating the causes of climate change will come in the sense that they will reduce the levels of air pollution, and by doing so, you can imagine the incredible number of lives we will save.
Thank you very much.